Certainly the budget is going to be a concern again this year, but I think it's a really good opportunity because there isn't a whole lot of money to spend, that you'll see some efforts to do more regulatory reform, and that is streamlining processes that make it more efficient for businesses to operate and actually get work done. You'll also see some more discussion about the fees that businesses pay, which actually is much like the budget. And you'll also see some opportunities for tax reform. And let us not forget, we'll also see some unemployment insurance reform efforts and workers' comp insurance reform efforts as well. Well, something that I think folks will hear a lot about this legislative session is, of course, the Federal Health Care Reform Act that was passed on the federal level, and now there are implications for the state. And so you'll hear chatter about the health insurance exchange that Arizona, much like the other 49 states, are going to have to implement by next year. And so there will be an effort to get that created and implemented so that we actually control our destiny as a state versus the federal government coming in and telling us how to do health care. Our members are hard at work moving issues through the process. I think our folks know that it really starts at our issue committee level, and we have 6 issue committees that are basically going through many issue discussions, whether it's workers' comp reform, unemployment insurance reform, education reform, fairness in fees, tax reform, and they're having discussions about it, what we want to go after proactively. And then we'll have some further discussion coming up at our public affairs meeting on December 9th, and we'll be ready to take these issues to our board of directors for approval. What's so wonderful about this chamber is that anyone can participate in our issue committees and our public affairs committee. And so we encourage members as they look at their area of expertise. So say, for example, you are an accountant or a CPA, you should get involved in our budget and tax committee because you know what it's like to implement policy. Is it a good thing or not a good thing? If you're in the healthcare industry, same thing. You should be involved in our healthcare committee. We need people that are practitioners in our membership that can tell us whether or not it's good public policy for the business community as a whole. So we really encourage our members to be involved, and there are other ways besides the committees. They can certainly come down to testify and again leverage their expertise and let lawmakers know what's good for business and what is not.